Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. We are today discussing about the anxiety. Right from childhood to the old age, you'd see anyone in any family. Most of the people are always having anxiety. They are worried. They are worried what is going to happen. So today we have a renowned psychotherapist as well as a Adhyatmik Jeevi, Pawan Srivatsa, who is going to tell you what is anxiety, what is healthy anxiety, what is unhealthy anxiety, and how to overcome this anxiety. Welcome, Pawan Avre. Welcome. So
Thank
please
you.
go ahead and tell us what is anxiety and why the people are having this anxiety.
Anxiety is something that the body experiences because of what the mind is saying to us, the consciousness. Usually, when a person is asked to write their thoughts that
Hmm,
leads them to anxiety, it starts with what if,
hmm,
or it will be having a few sets of rules like I should
hmm,
not, I
hmm,
must, I must not. These are the two reasons behind why a person is said to have gotten into anxiety.
hmm,
Something happens to me. What if my certain someone doesn't come back home? What if I
hmm,
fall ill? What if I die? What if I get a
hmm,
heart attack? Or
hmm,
I should not do this way. I should not do it that way. Oh, this
hmm,
shouldn't have happened.
hmm.
These kind of things will make us feel a few experiences, starting
Okay,
from which we call as anxiety. There are many
okay.
types of anxiety.
Hmm,
To mention few, one is separation anxiety, where you get anxious. What if you get separated from someone, especially when children when they go to school,
hmm,
or
hmm.
when there is a lady who has just given birth to a baby, and when someone takes the baby out for a small walk, what if they kidnap our baby? I don't want
Okay.
to get it from them. As a result of which they start feeling anxious.
So
This
these
is
are imaginary questions. They are
yes,
imaginary. Okay,
they anticipate it. They
okay,
anticipate, and
okay,
they believes it to be happening as if it is happening at
okay,
this way, and
okay,
so
oh,
into it. For example, my mind says to my body that what if I get into a heart attack? What if I'm experiencing a heart attack? So your heart starts palpitating. It
okay.
starts more,
Yes.
showing our consciousness that no, you are not dying. What if
Yeah,
my
the palpitation, you use the word, that palpitation is being aware of one's own heartbeat is the palpitation. So the common man, yeah, the dabba dabba, that they start feeling the heart beating, and that is palpitation. And that comes out of anxiety or a worry. Okay, go ahead.
when your mind might tell to your body that your temperature has increased all of a sudden, suddenly what
Hmm.
happens, you start sweating. These
Okay,
are very close to heart attack symptoms. You
okay.
start experiencing tension in your left hand, which they ask the Google doctor and they say, oh, I'm having pain in my left hand, I'm having
Hmm.
sweating, I'm having
Hmm.
palpitation, shortness of breath. It clearly tells you, go to a doctor, you're going to die in another 15 minutes. Right. So that anxiety in it.
But one thing, the person who is feeling the symptoms of this heart attack, they can pinpoint where the pain is. That is called as the psychogenic chest pain.
Yes, yes.
Psychogenic chest pain, they can point out where the pain is. Whereas in case of real heart attack, it is in the middle of the chest and then it spreads to the arm and the back. So that is entirely different. So just because they're sweating, just because their heartbeat is felt and their anxiety, that is not heart attack. So people should realize the difference between the two. Okay.
To talk about this a lot because just today, about 1.5 hours ago, I met one patient who had come to
Hmm.
the hospital with
Hmm.
complaints of a panic attack, thinking that it was a heart attack. And she
Okay.
was
Okay.
symptoms.
Okay.
We have to talk about this because people are afraid of death, especially after the two deaths that happened in the past 4 years. Two celebrities
Okay.
who take the names out. The fear of death has immensely increased. This fear of death.
And not only that, in just last 1 month, four people have died suddenly. while listening to the DJ music and by dancing and in attending the marriage, suddenly they have dropped dead. And that fear has, gone into the minds of the public. Yes.
What the media projects here is only what is happening in the foreground. They will not be talking
Yeah.
what is in the background and things like that. Coming
Okay.
back to the mind will usually be thinking about what is going to happen in the future. It
Okay.
predicts and the body believes that it would happen that way, and the body starts reacting to it as if it is happening at this very moment. So
Okay.
this is called anticipatory anxiety. We
Okay.
anticipate, as a result of which we feel anxious.
Okay.
We are to avoid a few things, as a result of which we feel anxious. Say, for example, there is some GST that has to be filed. I have not yet filed. I have not yet filed. I need to file it. Anxiety. We feel anxious.
Okay.
What
Okay.
if I?
Okay.
There are these two types: anticipatory, and the second
Okay.
one is. And when it comes to the other type of anxiety, which I have coined these two names, one is healthy anxiety and the other one is unhealthy anxiety.
Unhealthy anxiety. Yeah. Okay.
Unhealthy anxiety we talked about till now. Oh my God, what if
Okay.
happens? But healthy anxiety on the other side will help you perform better in your life.
Okay. Okay.
A few punishments that you are going to face in the future. Say, for example, following a diet plan, doing your gym or cardio or your yoga or pranayama.
Regular yoga and Surya Namaskara, when you do regularly, or even Ganesha Namaskara, they are very, very healthy. So that way, the mind will be calmed down. So I just want to ask you, Pavanji, by meditating or doing the mantra or japa or some type of mantra meditation, can we reduce our anxiety? Because the Western allopathy always they give the anxiety pills, anti-anxiety pills. So the Anxit, the word is given to the tablet, and they just go and buy Anxit tablet and take, and that is the tranquilizer. From the tranquilizer, they go into antidepressant. So they will be grading and they'll be drugging unnecessarily. So to avoid that, is there anything other than the pharmacological drugs?
Yes. Medication is not necessary. Meditation is enough.
Excellent, excellent, excellent.
Because medication is only
Hmm.
for the symptoms that your body experiences
Yes.
after the mind has done its work.
Okay.
So the Goli will not help you to deal with the situation in your mind, but with your
Mind.
body.
Correct. Correct. Correct.
It will help you with the effects of the mind on the body.
Okay.
To
The
find an
psychosomatic aspect will be controlled, but the
yes,
psyche will not be changed.
it will not be
Yes.
changed. In an answer to that question, we have to first understand about what is my relaxed state of mind, to which
Okay.
yeah, is very, very, very much important and very easy to do so. Just a deep breathing technique. Just deep breathing. While you are breathing in, your nostrils feel cold, and when you are breathing out, it feels a little warm. We don't have to do Nadi Shodhana Pranayama and all those things. Just deep breathing will also help you relax your body, and you can become aware of what is happening around you. These two things are bare minimum things that a person should do when a person is feeling
Okay.
angry.
You're talking about the deep breathing. In fact,
Yes.
I have seen the people who have got bogged down by the psychological anxiety, they always like, they themselves take deep breath, It is like what to say, the body reaction or the physiological reaction to the anxiety. So you are saying that to remove that, better to take the deep breath and then come out of the stress. Okay.
Come out of it automatically. The only thing is you need to breathe through your nose and breathe mindfully. That is the first
Okay.
step of meditation. That
Okay.
is towards meditation. Deep breathing through your nostrils and experience how your nostrils are feeling when you are breathing in, breathing out. That's
Okay. Okay.
that is
Okay.
the
Oh,
begins is what I say.
okay. Excellent. So you mean to say that the person should be able to take the good and the bad and whatever is happening in their stride. whatever happens, happens for good. If that attitude is there, people will not have the anxiety. That is one thing. The second, you asked us to be like a Krishna Paramatma, as he told, be sthita prajna. Whether it is good or bad, labha or nashta, whatever it is, you have to take both together, because whatever has to happen, it will come. So you cannot worry about what has happened in the past, because that has happened, and what is going to happen in the future you don't know. So why do you worry about that? So live today and do the work efficiently, and then you be a better human being, and be more successful, and keep your mind calm and cool, and be like a cool cucumber. And that's how Pawan is asking all our viewers to remain cool and not to have the anxiety. Thank you very much for your wonderful explanation and advice. Thank you so much.
So welcome. Thank you so much.